Hello, and thank you for joining us today for our special live streamed event, Creating Bridges for a Better Well-Being. I'm Doug Kane, Executive Director of the Providence Newberg Health Foundation. With support from generous donors, Providence Newberg Health Foundation helps us move beyond ordinary patient care to profound excellence in all we do here at Providence. We strive to improve the lives of family and friends and contribute to the vitality of our community. Donations to Providence Newberg Health Foundation help fund new technology, develop and sustain patient programs, and support care for those most vulnerable, including those who access behavioral health resources at Providence. Gifts made through this event will directly support the Better Outcome Through Bridges program, which we will talk more about during our program today. Today's event, in lieu of our annual Hearts of Gold dinner, will focus on behavioral health in Yamhill County, how the COVID-19 pandemic has affected our most vulnerable patients, and how you can help those in our community who need it most. Before we get started, I'd like to thank our sponsors who have made this event possible. We'd like to extend our gratitude to our Platinum Heart sponsor, ADEC, our Gold Heart sponsors, Metro West Ambulance, Scott and Loni Parrish, and Redmond Vineyard and Winery. Our Silver Heart sponsors, Dean and Pat Werth, Fortis Construction, JRJ Architects, and Marquee Companies of Newberg. Our Bronze Heart sponsors, Columbia Bank, the local Newberg office of Edward Jones, First Presbyterian Church, George Fox University, Judy Aldred, St. Paul Rodeo Association, and Vision Capital Management. And finally, our heart sponsors, Friendsview and Heritage Bank. Thank you to all of our sponsors for their generous support. Now I'd like to take a moment to introduce a new face in our community. Joe Yoder has been selected as the new Chief Executive of Providence Newberg. For the past 2 years, Joe served as Chief Operating Officer for Providence Milwaukee Hospital and Providence Willamette Falls Medical Center. We are excited to welcome him to Newberg in this critical leadership role.
Hello everyone. We hope you're staying safe and healthy, especially during the COVID-19 pandemic that has affected all of us. I'm excited to be here today to learn and listen about an incredibly important topic, behavioral health in Yamhill County. At Providence, behavioral health is more than mental health. It includes the treatment of mental illness as well as emotional well-being, domestic violence, substance abuse, and other addictive behaviors. At Providence Newberg, we believe by caring for the whole person, we can reduce the reluctance many patients have when seeking help for behavioral health issues. We understand the concern many feel when seeking treatment during the COVID-19 pandemic. While living through a pandemic is new to us all, some things are not. Providence Newberg and our caregivers remain wholly committed to your care and safety. Whether you need attention for something minor or major, we've put in place additional protocols to make sure you feel comfortable and confident every time you walk through our doors. If you need care, we are safe and we are open. Now I'd like to introduce you to our MC for this event, Mike Donahue. As a retired news anchor, Mike reported on major news events ranging from the eruption of Mount St. Helens to Y2K for over 40 years. Today, he'll be diving in with our panelists, Dr. Jerry Turgeson, Becky Wilkinson, and Elise Yarnell, on the most talked about topic of the year, COVID-19. Mike, thank you for hosting this event today.
Thank you, Joe. I'm just grateful for this chance to tell people what we're doing. And by the way, Joe, welcome to Newberg. You're really no stranger here. You're well respected in the Portland, Vancouver, Milwaukee area. You're an OSU alum, and you're going to find a lot of Beaver believers in this territory. Something you said to the board, the Providence board this week, really impressed me. You said that you feel accountable for the life and health of every person in this community. We are really glad that you are here. If you're watching this, you may be wondering where we are. We're in the main Newberg Providence Hospital. We all arrived here with our masks on, as you see, and you can take them off now if you'd like, because we are practicing social distancing. I'm at least 10 feet, maybe 12 feet from the closest person here. In case you were wondering if we were safe, we are being safe. We had our temperatures checked when we came in the building, checked out all our symptoms, so we are safe. Some of you may remember me as a television news anchor and reporter in Portland with Coin TV. I did that for over 40 years. 3.5 years ago, my wife and I moved to the Newberg area, and we just love it here. For the past 2 years, I have served on the board of the Providence Health Foundation, which is supporting this important work combating the effects of COVID-19 here in Yamhill County. You're going to learn more about this work, and you will be invited to participate in it a little later on. But first, I would like to share a story with you. It isn't my story, it's April's story. April is a patient here at Providence Medical Group Newberg. She has undergone 5 surgeries for endometriosis. She suffers from anxiety and depression, and it's often overwhelming. She and her daughter, who also is struggling with behavioral health issues, they were living in a shelter until April reached out to her doctor, who got her some help. But don't let me tell the story. Let's listen to April tell the story in her own words.
People have had rough lives, oh my goodness. So not a lot of people like to share that. They don't feel comfortable. They will hold it all in. They will drag them down to the deepest, and they're so loved. They are so loved.
BOB stands for Better Outcomes Through Bridges, and what a BOB worker is a person that comes alongside patients of Providence Medical Group or patients of Providence Newberg Hospital that are experiencing difficulties with social determinants of health needs. So that could be anything from housing needs, transportation concerns, food insecurity, safety concerns. The BOB worker wraps around that individual and helps bridge the gap to find services for that person or family in need.
I got to know Lindsay through Providence. I had came here and have been going through an awful lot in my life, a lot of surgeries and being homeless and going through depression and anxiety and raising my kids, also. And I reached out to my doctor and said, I need help. I'm like at my low right now.
We all need help sometimes, but if we don't have someone to help us when we need it, that's when we end up kind of going down a bad path. So just as loving neighbors and loving community members, to have kind of a support network in place through the healthcare system and through Providence. I get that image in my mind of like a hand reaching out to help someone stand up. It's like, I want to help you stand up.
There's just support everywhere that got me to where I'm at. We got a 2-bedroom place. It's quiet. Just started school. Foundational wise, I couldn't be any happier. It's just been a really long road.
There is a stigma around mental health. Thankfully, it's being broken down. But we all, if you want to call it mental health or behavioral health, we all have a mind that needs to be cared for. And part of that comes with heart and soul and spirit, which all goes back to the Providence Sisters mission and values, which I love.
Today, I'm so just honored and really privileged to work at Providence that really sees addiction and mental health as a disease and something that is our utmost responsibility to our communities to provide access to care for those patients experiencing those concerns.
How do you feel?
I just want to say to whoever's watching this and people that have funded this program, that have and that soon will, I just want to thank you so much for helping my life. You have touched my life in ways that I don't think that else would have been possible at all.
What a powerful story of how one connection, that's a word you're going to hear a lot, how one connection can make all the difference. Our thanks to April for being so transparent. And our thanks to Lindsay and the Bob, the Better Outcomes Through Bridges team. We have 3 members of that Bob team with us here, and they're going to introduce the program to you. But before they do that, I would like to introduce them just briefly. Dr. Jerry Turgeson is a clinical psychologist. That means she works directly with patients. And in almost a decade, she has helped a variety of patients. Becky Wilkinson specializes in behavioral health. That's something we're also going to define for you. Becky is an outreach program manager. She works, well, you say, in the trenches, out in the community. And Elise Yarnell is senior manager of Providence's clinic operations in Yamhill County. She also serves on the Newberg City Council, and she was the Chamber's Citizen of the Year. So you can see this as a very distinguished and knowledgeable panel. Dr. Turgeson, Jerry, let me start with you. What is your relationship to Bob?
Yeah, so I have been really lucky to work with Becky and the Bob team for the past, I think, 2 years now, and really working to integrate these services within our primary care setting, working closely with our behavioral health and primary care providers. Also in the school-based expansion program that we've been doing with the Adolescent Wellness Center at the Newberg High School. So it's a really incredible service where we can really connect our high-risk, vulnerable patients with emotional health, behavioral health presentations, and connect them with a provider who can help get them to the services that they really need.
Becky Wilkinson, you are the program manager. You might say, you make Bob run. What specifically do you do?
Yeah, so I manage the Bob program, which is a regional program here in Oregon. Specifically in Yamhill County, we have the largest concentration of outreach workers and peer support specialists because of the huge need. So I pretty much help the team do what they need to do to help our most vulnerable community members.
Lisa, you wear a variety of hats in this community, but your training is as a nurse. Tell us how your nursing experience helps build these bridges to patients.
Thanks, Mike. My interactions with the Bob team has been one where I oversee clinic operations, but so often we talk about social determinants of health and not really able to offer solutions to our community members for simple life needs. And, I just commend the work that Becky and Jerry do, and the Bob workers are housed within the clinics that I oversee. So they're an integral part of our team. And they hold a very special place in my heart, as I know that I really could have used a Bob at one point in my life.
Doug Kane and Joe Yoder mentioned the term behavioral health, and they said it's more than mental health. So Dr. Turgeson, could you define that term for us and explain what kind of conditions it covers?
Yeah, behavioral health is really a broad umbrella term that encompasses a wide variety of patient presentations. So there's the traditional emotional health or mental health component to behavioral health. So things like depression or anxiety. We have what we determine as health behavior. So things like the type of nutrition that you're able to get in, managing complex chronic health conditions like diabetes, and the impact that stress or emotions can have on that. And then chemical dependency and addiction. So there's really this broad umbrella that covers a lot of different areas of individuals' life, and social determinants of health are a key component for each of those areas. It's really hard within a primary care setting or a healthcare setting to lean in and engage and address how to manage your depression, how to manage your anxiety, how do we manage diabetes effectively if those really key basic pieces of food, housing, shelter are not effectively managed, and people don't have a safe space to be stable and secure, and then really look at those more complex presentations. So the work that we're doing with Bob really underlies all of the health and emotional health work that's happening within Providence.
Be touching on that term behavioral health more as we go on. Since March, as you all know, the world has been suffering, and I don't think that's too outrageous a word, has been suffering through this pandemic with millions of cases and hundreds of thousands of deaths. Here in the Newberg area, in the Yamhill County, as elsewhere, that pandemic has spawned another problem, unemployment. And that has brought its own physical, mental, and social problems. Becky, as an outreach specialist, you work with some of these unemployed. Talk to us about their challenges.
Yeah, I agree with you. It's a rough time right now. Our clients are extremely vulnerable. We're talking about folks that barely receive an income, if anything at all, aren't able to even meet their basic needs like food. So for those that are already way under the poverty line, losing a job or losing the little income that you have, it's devastating. And, I really, really fear for what the implications of this are in the next, 3, 4, 5, 6 months. And so I'm really, really grateful that we're all in this room talking about this, because I think it's really, really important for people to know what's going on and how they might be able to help.
Thank you. Well, when my wife and I, as I said, moved here 3.5 years ago, we were shocked to hear about suicides in the school district. I mean, school-age children taking their own lives. Dr. Turgeson, maybe at least either of you, if you'd like to respond to this, what is Providence doing? What is Bob doing to prevent this?
Yeah, suicide is a significant concern for our body, not only here in Yamhill County, but across the nation. One of the things that we know is that suicide rates have been increasing exponentially year over year across the nation, and Yamhill County is not immune to that. And the fear is that with COVID and the pandemic, we know part of those completed suicides are related to deaths of despair, which are correlated with things like housing instability, financial loss, inability to meet some of those basic social determinant needs. And so we are now in a pocket where we have highly vulnerable people who are, again, experiencing these socioeconomic impacts that puts them at a higher risk from a vulnerability standpoint for completed suicides. The other piece that I think is really unique for us is that we are a community that's been touched by suicide. We did have a number of completed suicides at our high school recently, both for students who are actively within high school, but then also recent graduates. And we know that suicide risk increases for individuals who have been exposed to or come in contact with a completed suicide. So all of our adolescents, all of our community is really at a higher level of risk simply because of now where we live, being rural and having been exposed to multiple completed suicides. So with that, Providence has really made some intentional steps to connect with our community organizations. That's part of what Bob does, is goes out and connects with individuals and helps them get connected with the appropriate levels of care so that they can get the treatment and the support that they need. Maybe they need support with housing, maybe they need mental health or therapy, maybe they need connection with a primary care provider. And Bob really does an amazing job in helping to support some of those connections. We've also created a really amazing partnership with our local high school and school district that's given us the space to go in and help support the identification and risk assessment of high risk or high needs students, and then help to provide intervention and support, whether that's through support from a behavioral health provider and therapy, or connecting with Bob and helping to support the family at a larger system-based.
So would you say that the key to improving this young person's outlook on life is building relationships? Is that the key?
Absolutely. Relationships are essential. When we look at overall determinants of health and well-being, having meaningful connection and positive relationship is an essential component to that. And having connection with someone who can really see you and validate and understand where you're at, and then in a relationship-based way, help to support you making the steps that you need to get to a stable space is incredible.
I noticed that the visits to Providence Newberg's emergency department have increased in recent weeks, and I'm sure COVID has something to do with that. Elise, tell us about these patients, whether they're in the hospital or in the emergency department, who leave and then they have no place to go. They end up sleeping in a car or in a tent someplace.
Yeah, so unfortunately, we have seen an increase in our ED volumes, not only in Newberg, but across the state for Providence. And, I think that's just why I believe so much in the Bob program. And, the one silver lining looking back in preparation, not knowing, was that bringing in Bob to Newberg was that we were pretty prepared to deploy people to support the people that are walking into our emergency department. One of our Bob workers, Lindsay, dedicates a significant amount of time to the emergency department and really wrapping around those individuals that walk in and need that extra support, whether it's connection to housing or food or addiction support. They really are those people. And in this instance, Lindsay really is that person that's able to spend time with that individual and build a relationship and get to know them. The one thing also, we're continuing to see an increase in acuity across our system. Unfortunately, again, as we see a surge in positive cases, the surge in hospitalizations is, 7 to 10 days after that symptom onset. So we're right now, actually experiencing the highest volumes in our hospital inpatient ICUs and med surg floors that we've seen since the tenure of COVID. And I think that sometimes can be misrepresented in the news and misrepresented in different conversations, not intentionally, just because it's such a fluid environment that we're living in right now. And it's really hard to keep on top of where the numbers truly are. So I feel very fortunate that we have the Bob program, as well as our entire behavioral health team, which, Jerry leads a really robust behavioral health team of 3 licensed psychologists. We have two psychiatrists, which is very abnormal for a community our size. We're really lucky to have that. And then we have a fabulous partnership with George Fox University for our student program that Jerry oversees as well. So we really were pretty well positioned to support our community in this time. But now it's really, how do we pivot as an organization to be able to make connections and care for these individuals in a more mobile, virtual way than we have really in the past of this face-to-face in-person care. And the one thing I'll say, just as a person in recovery myself, behavioral health, isolation is something that we so often are like, I try as best as you can not to isolate, and constantly checking yourself of who you're connecting with and getting together with people and making relationships. And, I think that that's really been the big test of COVID is, for people that experience behavioral health concerns like myself, how do we develop tools for our personal toolbox to be able to not isolate and create different strategies that are also going to protect our physical body as well.
Mm-hmm. April's such a good example of that, how she, a connection she needed to make with her doctor to reach out and get some help through the program. I don't know if any of you saw the HBO documentary, Weight of Gold, but it pointed out how our Olympic athletes, even gold medal swimmer Michael Phelps, struggled with anxiety and depression. I think there have been 5 or so Olympians who actually committed suicide because of this problem. And others are, crying out through the Olympic Committee for some kind of a Bob program like we have. Becky talked a little bit about how people are able to access help through the Bob program.
Yeah. So as Elise mentioned, we have Lindsay, who you guys saw in the video, who is our amazing outreach specialist. It's based out of the ER, as well as spending time in our family medicine clinic. We also have the 2 school outreach workers and an outreach worker that takes referrals directly from Dr. Turgeson's team, as well as our internal medicine team. Just another quick overview, we do have peer support that follows up with every behavioral health patient that originally presented in crisis. So that is a telephonic service that we offer at first, and if folks need it, in-person peer support. So there's a lot of different ways folks can access the Bob program. It's really, we do have specific criteria for ED utilization in our ER program. And for the clinics, folks just need to have a social determinant of health. They basically get a screening when they come into the clinic, asking, do you have a food insecurity, safety, transportation need? If they mention that they have a need in one of those, then automatically the Bob program will get a referral.
Some of these call them caring contacts that you have in the in the program, the Bob program, they actually have experienced some of the same problems that the client they're trying to help has experienced, right?
Yeah. So we have 3 peer support specialists who are absolutely amazing. And I have to say the entire Bob program is amazing. I might be biased, but I mean, these guys just jump into the trenches. I mean, you had mentioned the impact of COVID, and, when this first started 5 months ago, we didn't have anywhere to send homeless patients that either were under investigation for being COVID positive or were COVID positive. And this team immediately jumped right into action. We were able to work with our real estate department to secure one wing of a motel, and we were there 24/7 serving folks that were COVID positive, making sure that they were safe, that they had all the PPE they needed, that they were quarantined, getting food, etc. And so our peer support specialists that you mentioned, that do have their own lived experience, they all have, in one way or another, had struggled with homelessness, behavioral health condition, mental health issue, some in and out of jail. So by having them work with folks that are in a similar situation, they're going to be able to offer something that even the best social worker cannot offer. And that is a shared experience. And that's really where, when you talk about the relationship building, I mean, that's really where it comes from, is that connection that I'm not going to be able to offer.
We should point out that Bob does not work alone. We kept using that word throughout this program, connect, and Bob is connected itself to organizations, nonprofits, faith groups, schools. And I think there are some 1,000 community partners in over 200 agencies. And Dr. Sergeson, I suppose that this gives you more resources then to work with, right?
Absolutely. There's an amazing benefit being a psychologist working within a primary care setting, because I have the opportunity to access people where they feel comfortable. And the downside is that helping them out in the community get connected to the resources that they really need. So helping them make that next step to get connected with housing, or make that next step to get the shelter, is really difficult from the confines of primary care. And it is really impossible to treat depression well, or anxiety well, or addiction well if someone is experiencing food insecurity or homelessness. And so having a safe, trusted person that honestly I have a relationship with, that I can then hand my person over to, really provides that space that I know when I give my patient who has some identified needs to Christian, that she's going to be able to walk with them in the community and really help them get to that next level of care and support and resource, which is just an invaluable tool and helps me do my job better and provide better care for my patients. And we're seeing really amazing outcomes for some patients that have been struggling for a really long time. And I know Elise has also had some really great experiences with patients who have had similar kind of dual needs for behavioral health and Bob.
Yeah, one thing I was just going to add is that Jerry and I were a part of a mental health panel. Gosh, it was a few years ago now, hosted by the Austin Family Foundation, and they corralled all the community partners together that touch mental health and kind of said, "What's the deal? What's going on? Why are you why are you all asking for the same resources and touching the same people?" And it was a huge professional moment for me to just realize in this space of social determinants of health, but honestly, in every space of healthcare, we duplicate and think we can do things better than the agency next to us. And there isn't a lot of collaboration. And if you want to talk about cost of care, that has a lot to do with it. And so a huge part, and just a huge thank you to the Austin Family Foundation for getting us all together. And that conversation with those key agencies of Lutheran, our county health department, HHS, YCAP, Virginia Garcia, Love Inc., a lot of our church partners, the list goes on. It really has continued this conversation and sparked us really get together and have continued conversations. And, the real catalyst of that was our youth. And the Newberg School District really stepped up to say, we need support. And y'all don't fight over it. How are you guys going to figure out who can come in and who can support the needs of our youth? And, what Joe said at the beginning of this is just absolutely true, that it is every one of our responsibilities jointly to care for every person in this community. And so I just think about COVID right now, and that we really, went through some trauma over the last few years to get us to this place where we're actually pretty well positioned to collaborate to care for our community. And, that is a silver lining of COVID, that, I respect these other agencies and partners tremendously. And we're now at a place where we have joint strategy conversations of who's going to expand which service line in their organization. And that's not normal in the United States. It's not normal to not compete. And I think all of us in this conversation really have the desire to collaborate and reduce cost, one, but then also care effectively for the community members in Newberg and Yamhill County. So this is really supporting Providence through this conversation today. Really is actually, in my mind, supporting and trusting us that we are having these conversations to not duplicate services.
Realizing we're all in this together, and so we have to work together to find solutions. Yeah. You feel like the Bob program has a visibility in the community, that people are aware of it? Does it need to be promoted more? Anybody who can respond to that.
Well, I think we can always be better, right? I think we know what Bob does, but I think the highest point of visibility currently for Bob is within the Newberg School District. And Alexa and Renee are our two outreach specialists that are embedded within the Newberg School District, and Alexa specifically in the Wellness Center, and then Renee with the elementary and middle school families. And I would say that the community as a whole probably has felt the largest impact visibly from those two individuals. And it really has been structured in a way to not be Providence facing, having Providence infrastructure and support and resources and all that good stuff, but not a visible Providence individual. And that's more my style. I think it's important as a large organization to not always be in the spotlight. And so I think that both of those individuals have done a great job, and we have large plans with the Community Wellness Collective, Lutheran, and HHS to continue that partnership and really grow that and expand the work that they're doing. In terms of Lindsay and Christian, their impact at our clinic has been the biggest game changer that I have seen in my professional career, in terms of individuals that are able to just step into the deep end and make pretty drastic impact on health outcomes. My example I always go back to is, you can talk till you're blue in the face with a diabetic patient about healthy eating choices, when in reality, they have very little income to support their life. You're not going to make any impact if you never ask the question of, are you food insecure? So that alone, that's just one example, but example over example of the impact that Bob has made in our clinic, but then also in our community.
Well, so the infrastructure is there, but we don't want to give the impression that Bob doesn't have needs. And Becky, could you talk about some of the practical needs that are out there?
Yeah, as we've all kind of talked about the vulnerability of our clients, and then even more so now with COVID, the Bob program, as you mentioned, really focuses on relationships with not only our clients, our community partners, the hospital systems, everybody in this room, right? And right now, those small organizations are struggling, and a lot of them are laying off their staff, if not closing their programs altogether. So we're finding that right now, we're one of the only outreach programs that are really still on the ground working in the street with folks that really need it. And so, we have to be creative around, if somebody's a month behind on their rent or 3 months behind, or maybe has an eviction notice. How are we going to help them not get evicted? Because once you're evicted, you're never going to get back into another place with a really, really low income. So those are the types of things we help folks with. I mean, all the way to, basic needs like food, clothing, hygiene kits, to paying somebody's rent. We just worked with Lindsay on a different case around a client that was living in an RV and was not able to actually stay in there anymore because of the condition of it. So we helped clean that out. Just really patient, person-centered work. So, literally and figuratively meeting folks where they're at.
Those are all critical needs. That's a life-saving program that Bob is and has to be in our community. And so that's where, you as a donor, viewer out there, you as a donor come in. You need to help us so that we can, as a Bob team, can walk alongside these clients, these patients, these unemployed people, and help them find their way in a really challenging world right now. Elise, or anyone really, when someone gives to the Behavioral Health Fund, where does that money go?
Yeah. So I was just thinking of what Becky was just speaking about there. And, again, some of the red tape in healthcare and just organizations in general is people accessing support and financial help now. And I mean, I've had to file unemployment, my family members have, people are in crisis now and they're waiting for help now. And, 2 months from now, that help may come too late. And what Becky mentioned about evictions and what that can do for just someone's life, that all social determinants of health, if unable to be met, if their need is unable to be met in that moment, they all can have drastic impacts. So, the Behavioral Health Fund with Providence Newberg Foundation, it is a readily available fund for us to be able to access and provide immediate needs for our patients. And when I say our patients, I really believe that every community member in Newberg and Yamhill County can become a patient of Providence. And so just because you don't have a primary care provider at Providence Newberg, there are a ton of different ways that you can get connected to Providence, and we can support that individual. I just think about, I'm on all the Facebook Newberg discussions and Newberg info, and I'm just floored with the generosity of our community members and people's willingness to step up when someone is really, in my mind, courageous enough to say that they need help. And so this fund, I think of it almost in that way, that when we come in contact with someone and have the privilege of hearing their story and the needs that they're being met with, this is the fund that we're able to access to give them that temporary support. And, that the support doesn't end there. I think that's really important to note, that sometimes that temporary paying of a mortgage for a month, or of rent for a month, or paying their gas, that could be what makes or breaks them to be able to continue on in their family life situation that they're in. And a lot of my friends in addiction, it can be the smallest thing to some of us that makes the largest difference. And I have been in that place in my life where that small thing to someone is a big thing to me. So yeah.
It truly is a generous community. My wife and I have both been really impressed since we've been here, just a short time we've been here, how people respond to needs. I know, as you mentioned, some of the practical needs are right now, immediate needs, but I'm sure Bob would like to do even more. So let's dream a little bit, Dr. Turkison. What are some things that you'd like to do now so that you can, fulfill needs that people have that are being unmet?
Absolutely. So we have really big dreams for Bob here in Newberg, because really we have a lot of people and a lot of heart, and we have a lot of need in our community. So one of the biggest needs that we have in our community is really housing insecurity. We have a significant number of individuals who are actively experiencing houselessness right now. And houselessness and that level of instability really makes things like chronic health difficult to manage. The ability to stabilize an addiction or to get people engaged in addiction-based care to really effectively address mental health is a significant barrier. I live downtown. I currently have someone who is homeless who is parked on my street, and what that person really needs, I've had a couple conversations with them, what they really need is housing and housing stability and getting support, and meeting them where they are at right now. And so there are big goals and there are small goals with what that might look like. So peer support is huge. We have 5 amazing people who are going through the community, supporting people, but looking at what does peer support look like and how do we expand that out? How do we make sure that this program is secure, so that we can do this work for the long term and for the future? And then kind of getting back to that houselessness need, how do we do housing well to support our patients and our community with this really significant need that is present within Yamhill County? And Elise and I have had a lot of really amazing conversations, as well as Becky, about housing and what opportunities there might be and how Providence can help to support that, which is really the kind of some of the long-term vision around supporting Bob in our community.
Well, that's why we're coming to you today in this unique way. COVID has canceled our Hearts of Gold program this year, our fundraiser that we annually have. So we're reaching out to you online, and I think any gift probably would help, right, Becky? I mean, meal vouchers and hygiene kits, those don't cost a lot of money, right?
Yeah, you're right. I mean, hygiene kits, gas cards, people, those that are able to keep their jobs need a way to get there. Food. A lot of, as I mentioned earlier, a lot of community partners are closing down right now. So food isn't readily available. And sometimes, I think Elise mentioned, the food that folks need to stay healthy isn't always available in our food banks, unfortunately. So anything you can give would be amazing for our team.
Any other of you who would like to say something about need and, what money or any kind of donation could mean to the program?
I'm a little bit of a dreamer here. So there are absolutely immediate needs. And I think that is what we would prioritize the funding for. But, as a dreamer, Becky, to my right here, she really is the person that inspired me to really learn about housing and learn about the systemic houselessness within our country, within the state, and really within Yamhill County. And so through Becky, I got really involved and with some community members that are also passionate about housing, and I've had lots of conversations, lots of site plan reviews about what we could do at Providence in impacting housing. And as COVID has hit, everything is kind of on pause right now in terms of some of our big dreaming plans. But we do have a Health is Housing initiative. And I'm just super proud to work for a system that is on the forefront of housing. I mean, that in healthcare, it's, I believe, and a lot of the data represents, it can have the greatest impact on someone's overall health. And so we're really going to impact our patients by being able to provide a stable housing option. So I think also long-term, your contribution will support our ability to really get that seed funding to be able to mobilize a housing option potentially in our area. So that's my dream. And I don't think it's too far-fetched. I think that there's a lot of people in our Providence Newberg community and in our system that are full-fledged in support of housing initiatives for our behavioral health patients, addiction patients, medically fragile. So I'm really hoping that some of this funding can spearhead that work.
Right. Well, we're almost out of time. Anyone else have anything they'd like to say about the Bob program before we
I
wrap it up?
do. I'm talking a lot, but I just really want to say to everyone that is participating in this call, that behavioral health, mental health, addiction, I think those terms so often silence the conversation. And we think, oh, the people under the bridge, or the people down the street from my house, or the people on the news, or the camps over there. And that just is not reality. The truth is that all of us have some behavioral health need if we're really being honest with ourselves. And, my story is very much that. And I know Jerry has behavioral health needs within her life and family. Every person is impacted by behavioral health. And Bob is the program, and other behavioral health programs are the people that will be ready to care for you if and when that time comes in your life. So there's no shame in having behavioral health or mental health or addiction. It is just as the same as having diabetes. So I really hope that everyone feels loved and cared for during this time. And if you're experiencing any sort of isolation, that you reach out, even if you're not a patient of Providence, because we're really ready to care and serve you.
No, that's great. You've heard of the term or the phrase there, but for the grace of God go I. Me or you, it could be anyone. It may be your neighbor right now, but like Lisa's saying, it could be you. If you have any questions, we invite you to please email those to us, and you can send them to foundationevents@providence.org, foundationevents@providence.org, and we will follow up with you, and we'll find answers for you and communicate with you, carry on this conversation on social media. Dr. Turgeson, Jerry, and Becky, and Elise, thanks so much today for helping me. I'm really helping you, but helping me explain what Better Outcomes Through Bridges, what Bob is doing here in our community to help our most vulnerable members. The Bob program, I turn attention now to you, the viewer. This Bob program is only possible through your generosity. You make it run. You give us the support we need so that we can help people. And whatever you can give, whether it's $2 or $5,000, it will help. It will help Bob meet the needs of our neighbors, people in our community who have serious needs, behavioral health needs. My wife and I were making a gift today, and we would invite you to join us as well. To make a gift, let me tell you how to do that. Visit providencefoundations.org Newberg, providencefoundations.org Newberg, or text Prov Newberg at 555-888. Again, that's Prov, P-R-O-V, Newberg at 555-888. Again, we want to thank our sponsors for making this event possible today. But most of all, we want to thank you for your generosity. It is so important to our community. It's really a life-saving program. So in conclusion, be safe, wear the mask, practice the social distance, and in so doing, be healthy. Thank you so much for watching.